out and stuff like that. So
You just press the red button.
yes.
Okay.
All right, so I did it, and then you want me to go here?
Yeah.
Okay. So this is Ashley Anderson, and this is Class 50 doing a dental. So I have my instruments here. So I have my rongeurs, I have my scaler, my curette, and my probe. We also have the dental equipment here with the polisher and the ultrasonic scaler, and then the water and air. So I have my anesthetized patient here. We're going to do the first upper dental arcade. So the first thing I'm going to do is gear up. So I have my gloves. Mask, and face shield. Because we don't want the bacteria to aerosol and breathe in and get into our mucous membranes like our eyes, for example. We put a towel underneath the patient's head to help kind of keep things dry, and to kind of have his head in a downward angle to prevent aspiration. So the first thing I'm going to do is kind of just look at his teeth and his head. So you can see that's his neck. There's no drainage in his eyes or his nose, no masses on his neck. You can feel his mandibular lymph nodes to make sure that there's nothing obvious or large or hard. You can even feel his salivary glands right here, which are right adjacent to them. Then you're going to look inside his mouth, and so he definitely has periodontal disease here, so especially this one right here. So you have your canine, your premolars, and your molars here. So he's definitely got some gingivitis because you can see the redness in his gums. So you're going to feel for any types of masses, which I don't feel for any. I don't see any broken teeth, any abscesses. Feel underneath his tongue for masses, and then pulling his tongue out and just looking at his tongue to make sure that that looks good. Okay, perfect. First thing I'm going to do is remove the heavy calculus off. So what I'm going to do is, here's my model of my tooth right here. I'm going to kind of at an angle just kind of chip it down like this, making sure that I don't get the gingiva, and then the same with the canine, just kind of chipping it down like that. So we'll do this canine first. And you're just kind of breaking it up. Okay, and then there's a piece right here. So sometimes you have to adjust, there we go, angles to get them. And then you can wipe it off on your gauze. So he's got really soft plaque, and so it's not coming off in a very hard piece. So you're just kind of breaking up. There's a good piece right there. Like that. So we're getting a lot of good pieces off. So you can see that his gums are getting irritated because of his periodontal disease. Try to get this piece right here. Perfect. Okay, so we got a good portion of it off. You can kind of rinse it and see. So it's definitely got a good portion of it off. So after you're done with that, what we're going to do is we're going to remove the remaining calculus using the ultrasonic cleaner. So you're going to make sure that you don't put the tip underneath the gingiva line here. You're going to kind of go in a circular motion like this, and not putting the ultrasonic cleaner longer on each tooth for 10 to 15 seconds because of the heat. Can actually burn the tooth. So in the dental model, I'm kind of holding it like a pencil and doing a circular motion using the side to kind of break up the calculus and tartar. We'll start with this canine. And then we're going to keep alternating so that we don't stay on one tooth too long. So you can see that it's starting to break up the tartar. So some are going to be harder than others. And then getting it all the way back here. So he's definitely got a big piece right here that's kind of hard. So we're going to just keep working on it. A little bit of a piece right here. So you want to get in the groove. Like that. So then I can actually use the air to kind of look underneath the gingiva. On the tooth here. So he's definitely still has some here. So we're going to try to get that. Okay. So I'm going to take the dental curate here and I'm going to go in the subgingival. I'm just going to kind of glide it underneath just like this, perpendicular to the gum line. So just like that. And check for any tartar that could hide underneath, which I don't see any. Do that one more time. Okay, so now I'm going to rinse. And when we did the other side, we actually got the lingual area of these teeth too. So now that they're rinsed, I'm going to polish. So I'm going to take the polisher in the polish, and I'm going to go in a circular motion for about 2 to 3 seconds on each tooth. So I'm just going to move my pedal over. It's actually going to come on this side. And polish each side. Okay, now that's polished, I'm going to rinse. teeth. So you just go under the gingiva like this. And so he doesn't have very many pockets. They're about 1 millimeter. So there's no deep pockets that I see. Okay. Okay, go ahead. So just to recap, with the hand scaler, I went underneath the gingiva like this and to clean up what was underneath. And then for the periodontal probe, you're going to go underneath the gum line as well, in all these grooves to make sure that there wasn't any other pockets. And then when I polished in a circular motion for no more than 2 to 3 seconds, because I don't want the tooth to get too warm and too much frictions, because that can actually damage the teeth. And so for every tooth you scale, you have to polish, because you're essentially making holes in the tooth. And so when you polish it, it smooths it over so bacteria can't go back inside. Okay. Now I'm going to do a post-cleaning oral exam. So I'm going to look inside here. So you definitely have some residual bleeding from the gingivitis, so that's something that I will note to the owner. But no broken teeth, no loose teeth, no fractured teeth. His mucous membranes look good. And so if there was like a large pocket or a fractured tooth, what I would do is I would go on his dental chart and I would make notes on each one of the charts here. But so far, for the side that we're working with, he doesn't have any issues that I see. And then I'm just going to do one more rinse. And then I'm going to take a towel and then just make sure that I clean up his face, because you don't want to send them home to the owners with debris on their faces. Okay. So now that we finished the dental cleaning, it's important to document what we saw. And so the purple here is where the heaviest tartar buildup was, and so I just marked that here. He actually didn't have any broken teeth, oral masses, fistulas, rotated teeth, retained teeth. And all of his periodontal pockets were in good shape, so there's really nothing to note, just to kind of keep an eye out for these. And so you'll label that and then put it in their chart. Okay, so Rufus just had a dental cleaning, so he had general anesthesia, so usually wait about 4 hours before you feed them, and then give them a little bit of food about 15 minutes apart, because sometimes it can cause nausea and make them upset. Tummy upset. He's going to be a little loopy for the next 12 to 24 hours. It takes 12 to 24 hours for anesthesia to leave the body, so just be careful with him going up and downstairs, furniture, things like that. Okay. So overall, he looked really good. He didn't have any large periodontal pockets. No teeth had to be extracted. His main problem was just tartar buildup. Okay. So you can see here where we highlighted on the dental chart the teeth that had the most tartar on. So some things that you can do is put some additives in the water, brushing their teeth. And here is a handout on how to brush teeth. So usually you do enzymatic. It's not like you use dog toothpaste that's enzymatic, so it's not more of a brush, and it's more just applying them on there for you. Okay. I know he's on a specialized diet, so dental chews are going to kind of be tough for him. So that's something you talk to the doctor about as far as what his diet will entail as far as dental chews that will help. Okay. But we recommend getting a dental once a year as far as routine cleaning.
All right, perfect.
Any questions?
I guess just if I, brush the teeth, will I have to still come in for a dental? Or?
Yes.
Okay.
Yes. It's more of a maintenance thing, but dental is not going to remove the hard tartar buildup that you get underneath that you can't see.
Oh, okay. Well, that's good. Well, I'll start trying to brush, and I'll get him in once a year for his routine cleaning. I really appreciate all you did.
All right,
Thank you.
Okay, so this is the last half of the dental video. So I'm going to show you the different types of teeth here. So I have my model here. So the top arcade, you have the incisors, the canines, the premolars, and the molars. And then for the dogs, they always have one extra one on the left side. And then for the bottom, you have the incisors, the canines, the premolars and then the molars here. So you have the buccal side, which is the side of where the gum is. Then you have the lingual side, which is the side where the tongue is. The dental formula for dogs is that they have 6 incisors, 3 on one side, 3 on the other side, 2 canines, 1 on each side. Premolars are going to be 3 on each side, and then the canines on the one side is going to be 2 and the other side is going to be 3. For cats, it's 3 incisors on each side, 2 canines, 3 premolars, and 1 molar on one side, 2 molars, or no, it's 3 premolars on one side, 2 on the other, and then 1 molar on both sides. Dental radiology is really important because there's a lot of things that can cause problems that you can't see through the surface, and so this is a cool model because you can actually take the tooth out, so you can see that the root's down here. So if you look at it, all you're seeing is the surface of the tooth. You're not seeing what's underneath. So they can reveal like abscesses, cracked teeth, big pockets, and things like that. And so that's why it's important to get the dental radiography done. So you have calculus, which is calcified plaque. Periodontal disease is where the periodontal pockets tend to recess back, and so that's an issue because you can get tooth loss through that way. Fractured teeth, just when they get cracked, they can do it through trauma, through malnutrition, things like that, and so you want to get those removed and corrected because they can be painful, and they can actually, you'll have the inner surface of the tooth exposed. It can be very painful. It can actually cause an abscess through that too. Worn teeth happen when dogs chew excessively on certain toys. So like the surfaces down here would be flatter than that. Tooth root abscess is where you get an abscess underneath the gum line here from the tooth root, like that. And orodental fistula is when you'll get an actual fistula that comes up here through the palate, up and through the nose, and that's again another sign of dental disease. It's important for owners to understand at-home care instructions. You want to make sure that they brush their teeth, they monitor their teeth, they look for signs of discomfort, they look at the gums, see if they notice any bleeding, see if they have any fractured teeth, if they are having trouble eating hard food. Just getting drops to put in the water. They have some of those dental drops can kind of help, and just frequently brushing the teeth. It's not going to prevent you from having to get a dental done, but it's going to help maintain it in the meantime. You can do those greeny dental chews things and things like that they can help as far as that's concerned too.